Thanks, Mr. Chairman. Welcome, Madam Secretary. Senator Murray and I on the Help Committee are trying to get a few things actually done. We've reported a bill on elementary and secondary education. We're moving ahead to higher education. As you know, we're going to get into innovation in medicine. And one other area where I believe we could get something done is electronic health records. And you and I have talked about that. You've talked about a year and 9 months left for you. And what I'd like to do is to move up toward the top of your list and our list, doing something about electronic health records. The government spent $28 billion subsidizing electronic health records. Sounded like a wonderful idea, but half the doctors are choosing not to participate in the program. Instead, they'll face Medicare penalties this year. Doctors don't like their electronic medical record systems by and large. They say they disrupt the workflow. They interrupt the doctor-patient relationship. They haven't been worth the effort. An AMA-commissioned RAND study found electronic health records are the leading cause of physician dissatisfaction. A medical economics survey last year found nearly 70% of physicians say their electronic health records haven't been worth it. Now, I've met already with Andy Slavitt, and at your suggestion, I'm meeting with Dr. DeSalvo. And what I'd like to do with the committee here listening, well, one other thing, Senator Murray and I have formed a bipartisan working group on the Help Committee to identify 5 or 6 problems in the electronic health record system that we can address administratively. In other words, you could do it, or legislatively if we have to. So what I'd like to ask you is, will you commit to putting on your list of things that you'd like to get done in the year and 9 months that you plan to be here, working with us, identifying 5 or 6 things that would make this promise of electronic health records something that physicians and providers look forward to instead of something they endure?
Yes, and after our meeting, in our conversation, I think we've got a working group of staff ready to go, and we are committed to do that. I think this is extremely important in and of itself, but all the things it touches, we're going to talk about so many things it touches. I'm sure I'm going to get a question, hopefully, about opioids and heroin. Electronic records touch that issue. The precision medicine issues that we're talking about, electronic records touch that issue. Delivery system reform, creating a system of healthcare delivery that has better quality and is more effective and efficient, it touches that. And so we should focus on it in and of itself. It will have so many, where healthcare is going and where everything is going in terms of our ability to serve the consumer, the patient, in the way we need to. This is a core part. So welcome the opportunity, look forward to putting the list together, and look forward to getting it done. We'll look at our administrative things, and we want to work with you all on what we need legislatively as well.
Good.
Maybe some things.
Great. And there's a lot of interest on the committee. Senator Cassidy's expressed that. He's a physician himself. Other members on the Democratic side have expressed that.